Everyone once again for yesterday's wonderful group work and interaction. I think some of the groups were discussing, some of the groups were not really into that game really well. But I hope you understood what you're supposed to do in groups at least by today. Yesterday we have shared a lot of materials on pain, and yesterday we shared the PPTs also, PPTs and the assessment and the trainer's guide. Hope you got some time to at least one document uh, uh, for today. So today we will be in the same groups. We'll be discussing about you are assigned with topics. I know that there are two groups with the same topic on management of pain, but of course you will have different ideas how to teach management of pain for students. So you will be assigned to the small groups again, like yesterday. Please come up with ideas that how we can implement this when you teach students. There can be different teaching learning methods, any unconventional teaching learning methods that you already do or plan to do, please share with us. And I expect other group members to comment on what everyone shares in the large group. So today we have Dr. Sunil with us for the discussion after your group work. Dr. Sunil is the additional director of TIPS. You might have seen him during session on pain during your foundation course. So Dr. Sunil and myself will be moderating today's session. So you will be assigned to the groups now. We'll see you after 30 minutes.
now it is a post-test evaluation. Is the format acceptable to you?
Today we'll start with group 5. Who will be presenting from group 5?
Hello.
Yes, ma'am.
Hello. Good afternoon, ma'am. It's Dr.
Ma'am, you are muted. Can you unmute?
Ma'am, hello.
Yes, ma'am, please.
Hello. We are presenting module 3. This is for third semester MBBS students. And our topic is application of pain relief to suit individual needs. And duration given is 2 hours. So our competency, the learning objectives at the end of session, the students should be able to know about how to evaluate patient. And for the evaluation of patient for pain, we will teach them PQRST module. P means provoking factors, the factors that which are responsible to increase or decrease the pain. Q stands for quantity of pain, what kind of pain this is, like it's crashing, it's a stabbing, it's uh, thrombotic, what kind of pain. And R stands for radiation, means whether it is radiating to anywhere other part of the body. And severity means just to measure the scale, the severity of the pain on different pain measuring scales. And T stands for timing, whether it's intermittent, it's continuous, depends. And we will also teach them to look for other systemic illnesses which might aggravate the pain or which might be responsible for causing pain, or the discomfort caused by these systemic diseases might be perceived as a pain by the patients. And on the basis of this PQRST evaluation, we can differentiate, or we can reach to a diagnosis whether patient is having acute pain or chronic pain, or if it is chronic pain, whether it's a neuropathic pain or whether it's a combination of pain. So it will help us to reach to our diagnosis. Then second thing is, uh, uh, then we will teach our students the multimodal approach to treat the patient. Uh, this will include the WHO ladder pattern, which will include all kinds of modality to manage the pain, like pharmacological, non-pharmacological, depending on the type of pain and the requirement of the pain management. Thirdly, we will teach them the factors which are responsible to modify the pain perception, means uh, how to approach to a patient which is having a total pain. Like total pain means patient will be having all components of the pain, like physical, like psychological, like the spiritual and social kind of pain. Uh, so we'll teach them these modifying factors, because these factors might affect, or this will affect the perception of pain. Sometimes the patient is psychologically ill, so he will perceive a small pressure, even a small pressure on his body, it will, he or she will perceive it as a pain. So it is very important to rule out the whether patient is already having any whether pre-existing psychological disease or not. And we will teach all these things through the PPTs or case scenarios, or small group discussion or large group discussion through this. And for the all these competency, our domain will be know, and competency level will be knows how. Then we will distribute all these things as per the timeline. For initial 10 minutes, we'll teach the patient these different learning objectives, all these three. Then we'll distribute our students into 4 groups. And all the 4 groups will be given different case scenarios. Like one group will be given a patient having cancer patient. One group will be given a patient who is having life limiting illness. It may be neuropathic pain. It may be autoimmune disease like multiple sclerosis. It may be muscular dystrophy. And these patients might be having, in addition to these diseases, they might be having other systemic diseases like compromised kidney diseases, compromised liver. They may be renally compromised, or their liver may be compromised, or they might be having diabetes or hypertension, other kind of things. Then they will given this different case scenario, and they will be given 15 minutes to discuss these case scenarios among themselves. And after this, once the discussion is over, then they will be given 4 questions to regarding their case scenario to answer these questions. And once if they are once they will complete their questions, then they will be given their feedback. So what is still to be covered, or uh, how what way they can do it in a better way, or what are the better way to perform it. And uh, while they are assisting their patient, or while they are approaching their case, will assess the patient, will assess our students how perfectly they are taking the history, because this competency is basically related with the domain K. So there's nothing like show and show how demonstration kind of thing. So we'll listen to them and how perfectly they are taking the history, because if we are asking them to take the perfect history to rule out the other type of pains, because we have different type of pains like physical, spiritual, social, and spiritual type. So when if patient is saying ki I am having pain, so before labeling the patient is having actual pain, we need to rule out the psychological component, whether he or she is suffering from any psychological element or not, or whether he or she is taking any kind of uh, recreational drugs which might affect their perception of pain. Okay. And after then, in last 10 minutes, we can summarize the things, how much they understood the subject. We can ask them to write down the things they have learned today, and what is the thing that they understood, they like most, and what is the thing, yeah, how what is the way that we can improve our way of teaching them, a kind of exit slip kind of assessment of the patient. Lastly, this is for our feedback, also for the feedback of teachers or trainers.
Thank you, Dr. Urmila, for summarizing the point discussed in your group. Maybe they already go through, like, it's an excellent plan to incorporate case scenarios in the discussion, because the topic itself is application of pain relief in scenarios, right? So they may not be seeing the actual patients by that time, but as you said, you can give different scenarios in the different groups. And very noticeably, like, it is not just cancer pain, but we'll be giving 4 different scenarios, three other, maybe other than cancer. So they will know that they have to do the pain assessment even if there is no cancer. For any patient coming in with pain should be assessed. So some of the theory sessions that you mentioned in the beginning, like assessment part, will be covered by, I think, in the first year, second semester, or I think it's in the second semester. So maybe you can just, as you mentioned, you can just brush through it so that they'll kind of revision of what they have heard before, and then move on gradually to the case
Yes,
presentation.
yes. In the initial part, and then within the initial 10 minutes, we can recapitulate the previous things that that students have been already taught in the module 1 and module 2.
And it is always a good idea, as you said, in the end, to ask them. There may be students who might have learned something really new by this session, or they might have thought, okay, this was not necessary, but now they learned, okay, this has a major role in the total pain. So it is good to ask them to write about it. I mean, most of them will write nothing new or something, but at least some of them might have learned something, and asking about our own teaching feedback is another. I think that's kind of mandatory in almost all the subjects, right? In your teaching, you may ask like how your session went.
No, they
Uh,
can do it through exit slip method of assessment, the student feedback.
yeah.
Exit slip.
Thank you. Thank you so much, ma'am, for sharing. Dr. Sunil, anything from your side?
Thank you.
So I think that was a very good presentation. A few suggestions which I can add as many a times what happens is usually we will assess the patient's pain by looking at the patient expression. If a patient is smiling and um, usually we think that that patient will not have pain. But I think it will be good to bring a patient story like a patient who always smile. Do you think this patient has pain? Something like that will be good because we have some patients who has chronic pain, and whenever you see them, they will just smile. Whenever we uh, but whenever we ask them what is your pain score, they will tell it is 10 by 10. So I think that need to be known to the students. So maybe a question can be framed like that, or uh, somebody can or the teacher himself or herself can play the role of a uh, patient, and then ask the smile at them and ask them to assess the pain, so that it will be obvious to the students. And another way, I think pain assessment, there will be a, I think we have some videos of pain assessment which will be good to show them, so that they will exactly understand what all need to be asked. And I am sure this has to be in local language, so it would be different for different the faculties who are here. Uh, and yeah, in the evaluation, I think even though we are looking at PQRST, I think we have to also include what is the effect of pain on ADLs, activities of daily living or function of the patient, which is very important. Otherwise, we will be more mechanical. So when you ask what is the impact on your impact of pain on your ADLs or functioning, then we will get a clear picture about how the pain has affected the person. So I am unable to take a bath in the morning. I am unable to eat. I am unable to sleep, and I am unable to go for job. So that means all the functions are affected, and it is a very severe pain. So uh, it's a good practice to include what is the impact of pain on patients' daily activities of daily living. Yeah, that's all, Sreedevi.
Thank you, sir. We will move on to group 4. I know that there are a few members of group 3 we included in group 4 because group 3 did not have not more than 2 people. So we included them in group 4. So group 4, who will be presenting from your side? And you will be talking about management of pain. Right? Who is from the group 4? Yeah, there are so many people in group 4 plus group 3. So who was planning to present it to the larger group, or you are still discussing for 30 minutes that who will be presenting? Dr. Priyanka, Dr. Ranveer, Dr. Rupam, Dr. Sarita, Dr. Shatrupa, Dr. Shivani, Dr. Subhash, everyone in group 4.
Dr. Sreedevi, I would like to ask, will it be a combined presentation or 3 and 4 need to present individually?
There were no members in 3, ma'am. There was only one member. So we
Yes.
added them to
Actually,
group
we
4.
had a common topic as well. So
Yes,
will
yes.
it be a single
No,
presentation?
so the plan was 2 presentation because people will come up with different ideas. But there
Okay.
was only one person in group 3, so we added them to group 4. So it's the presentation from group 4. Whichever name I told right now is from group 4.
Right. I think Dr. Shivani. Dr. Shivani from our side will be presenting.
Yes, Dr.
Shivani Bhagat.
Shivani.
Hello, everyone. Good afternoon. So, in the management of pain, first, I would like my students to know a little bit about the pain itself. So, we will try to recapitulate the things with them. We can give them the learning objectives initially and tell them to come prepared for a SDL, self-directed learning type of activity. Okay, so in this, we want them to know the definition of pain, the latest updated definition of pain. What are the different pain pathways? What are the different types of pain? What is gate theory of pain? And what is the WHO ladder for somatic as well as neuropathic pain? Okay, and after that, after this SDL activity, then we can incorporate a lecture also, didactic lecture also in that activity, in which we will try to teach them what are the different components of pain and what are the different assessment tools we can use to assess the pain. And so that would be a didactic lecture. And in that lecture only, we can cover up the different pharmacological and non-pharmacological treatment options which are available to manage pain. Right after that, we can keep a short group discussion activity in which we will give them different case scenarios, and based on the treatment options which we have already taught them, we can tell them to come up with their own P drugs, that is the preference drugs, which they will choose for that particular case scenario. So this would be a short group dynamics type of activity, short group discussion. And after that, we can also show them actual case scenarios in the hospital where they can go and look at the patients, maybe the cancer pain patients and other patients with severe pain, and they can assess the treatment charts and see the treatment options which are already given to them. So that way there will be a clinical exposure also. So yeah, for the assessment, we can take a written test after the didactic lecture. We can also take the viva, and we can assess them by role play, in which they have to prescribe and then communicate to the patient the different treatment options. So yeah, that would be the whole. Thank you.
And prescription writing.
Yeah, prescription writing.
They'll be given different cases and they'll be made to write prescriptions respective to their cases. And we can have a checklist of how to assess that.
Thank you, Dr. Rupam and Dr. Shivani, for summarizing. I think it's very important, especially when you teach pharmacology, to make it a little more interesting, because none of us would have enjoyed pharmacology lectures. So, as you said, going to the ward or a cancer patient's ward and looking at the charts. So, I am sure there is, like, most of you might be familiar with the early clinical exposure. So this can be a part of that. So they don't need to go to the actual patient, but they can just look at the charts and tell them to note down the points as a group and then come back and discuss what they have seen. And from there, you can start probably, or maybe you can flip it. You can start with looking at the charts in the beginning so that there is some curiosity, okay, whether this is right or wrong, or what is there to be learned. Just a suggestion. So yes, Dr.
The
Shivani.
thing is that they must at least know the different treatment options which is available.
Yes.
So we need to tell them the groups, the broad groups which are available for treatment of different types of pain. So
Yes,
that's
very
why.
true. Yeah. So then they go back and then they feel that, okay, this is some actually happening in the charts, and then come back and probably discuss about any modification, or probably then you can talk about the non-pharmacological, because that may not be mentioned in the chart. So you can ask what else can be done other than giving all these medications and etc. Excellent plan to go ahead with that. One more thing I was thinking when you were telling.
Ma'am, I want to add one thing.
Yes, Dr. Manisha, please.
Yes, ma'am, I'm from group 3. I just wanted to add that assessment, when we discussed in group 4, the assessment can be in the form of pre-test and post-test also. When we are
Yeah.
giving SDL, after that we can give pretest to the students, and at the end of the session, next session, we can give them the post test.
Yes, yes, because it's mostly with the medications, so probably we can give MCQs before the session and ask after the session so that we'll understand where exactly they stand after the session. And I hope at least some of you will ask your pharmacology colleagues for the integration probably. Maybe we can take the session on opioids, right? Anyway, they are taking the session on opioids. We can just ask, can we talk about the NSAIDs and opioids? Instead, we can take it. So it's happening in many places because of all this vertical and horizontal integration. So we can ask for 1 hour and whatever we have learned or we have seen
Wha-
in your sessions. Yes, Dr. Rupam.
One thing more, I just want to know whether we'll be able, taking the session on pain management in just 1 hour lecture, or we can devote more than one lecture for the same.
Definitely, we can, depending on institutions. Some institutions, like definitely for pharmacology, there is dedicated hours for teaching analgesics, right? We are not
Right.
asking for any extra hours. We are
Right.
asking whether we can be part of the teaching. Like
Right.
when the integration happen, anatomy, the medicine people are going and teaching, surgery
Right.
people are going and teaching. Same way, when they talk about the pain management drugs, the pain specialists or the palliative care people going and teaching. We are not asking for any extra hours. Whatever dedicated hours are there, along as Dr. Shivani mentioned, you can add an element of clinical exposure there also. So
Right.
I hope you will be able to manage in that time. And later on, you will be showing this or role playing when they are coming to the clinical side, right? If you are in the clinical department, they'll be coming for postings in your department where they're actually seeing the pain management. So it's a
Right.
continuous process which starts.
Yeah, actually, there are dedicated hours also, I guess, for the integration purposes.
Yes,
For
Yes,
yes.
for AIT. AIT, as they call it.
Dr. Sunil? Sir, you're muted, sir.
Okay. So a few suggestions are, I think it is important for the students to know the side effects of each medications, because this is a usual practice whenever we prescribe morphine, and if this patient is also consulting somebody else, usually the patient will come back to us and will tell us, the doctor asked us who prescribed this medicine, what is the need of this medicine, your disease has not progressed so much. So this misconceptions and things like that, I think we should be able to convince these young guys to understand these are medication as per WHO analgesic ladder, which is practiced by uh, many countries. If you look at the pharmacological textbooks, uh, two of the feared side effect of opioids would be respiratory depression and psychological dependence or substance use disorder. We should be able to provide evidence to say that, okay, these are not a problem if we use medications properly. Uh, and Another thing, if you talk about NSAIDs, I think it would be important that we should be able to speak about the COX-2 selectivity of NSAIDs, because diclofenac is a medication which is used by everybody, but now more and more evidence say that COX-2 is uh, more COX-2 selective. So there is a tendency that it can produce thrombosis if you use it long time. So once we give a prescription to a patient, the patient will continue to use it, not only the patient, caregiver and neighbors. So it would be really important for them to understand this also. Uh, so those are 2 points, and I think prescription writing is a very good way to teach the students. You give a case scenario, ask them to prescribe, or you can project a case scenario with a wrong prescription, and then ask them to give suggestion how to make it correct. So these are two suggestions from my side. Thank you.
Thank you, Dr. Sunil. And I think that's another important part that I wanted to, when you send to, I've personally experienced this once. We send to the ward and tell them to go through the charts and then come back. Probably there are big mistakes in the chart itself. So then you can't say that might be written by your department head probably or your colleague. So you can't just tell them to correct the prescription. That's a little sensitive. So we have to be really careful when we tell them.
That is what pharmacologists are meant to do, prescription audit. But we are very scared to do that.
Yeah, very true. And then you can't say students that is a wrong thing, because that might be written by a prominent faculty there. So giving we can take from that the real scenarios, maybe taking a picture or something and projecting it and tell them to correct it, so they won't know who has written it. So you can create it. So in the templates that we have shared, we have created a few prescriptions for you to use if you want. That might be one thing, because I was just thinking, when they go to ward and see and find out, and then why then these people are writing this, you told opioids can be used, but they have written something else. So then we might be confused how to deal with that. So that's something which needs to be careful. Thank you, Dr. Shivani and the team, Group 4.
Ma'am, can I put one input?
Yes, Dr. Mrinal, please.
So I'm from Group 3, and in pharmacological preparations, I also want to include this nerve blocks that has been practicing very nicely nowadays. It can be done in OPD basis also. It can be done on the CM also after admitting the patients. Because I have seen that those patients some patients, they are taking opioids, but it doesn't relieve. Or maybe they are taking opioids for so long that they are exhausted. So they want some good relief, and nerve blocks works very nicely.
Dr. Mrinal, are you an anesthetist?
No, ma'am, I'm not.
Okay, so
I have done nerve blocks with one of my senior colleagues. And he has shown us, and I have tried also, and it was very useful.
I agree to that. Maybe, but third semester students, it might be a little early, because they'll be so enthusiastic to focus on the blocks rather than learning the medications. But there are 6 modules that comes under anesthesia, and one focuses on intervention. And by that time, they'll be in the clinical posting. So that might be a time where ideally you can incorporate these people. When they come to medical school, they'll be so eager to know all these techniques and learn. So the focus may shift from the medications to the injections and the blocks. So under anesthesia, they'll be already undergoing, they might have done their medicine posting by that time. So there are 6 heads under anesthesia, where intervention is one among them. So that might be a right time. Very, very rightly pointed. Thank you, Dr. Mrinal. Yeah, Dr. Indira is also suggesting we can create our own prescription in wrong ways and ask students. Very simple thing, writing an NSAID, not writing a PPI. Simple thing. So they'll remember that whenever I write an NSAID, I have to write a PPI. So these simple things can be included in the wrong prescription. Thank you so much for the inputs from others also. Thank you. Next is Group 2. Who's presenting from Group 2? Maybe you should decide who will present by today or tomorrow, so that you don't have to waste time in the group thinking who will be presenting. And take turns for presenting. Group 2, I think I start. Dr.
So Dr. Kalindi will present
Yes,
from our side. Okay.
Dr. Kalindi, yeah. So tomorrow, Dr. Shivani and Dr. Kalindi is going to be quiet, because everyone is taking your names. Yes,
they
Dr. Kalindi,
they are good presenters, ma'am.
Good afternoon.
Sorry, just to say, this is how you will get the response from students when you are telling about all this group work, right? See how difficult it is to make you people to discuss in your groups and to come back and discuss that in the bigger group. So we have to make the ground rules very clear that who is going to present, how much time you will take, you come back. I cannot insist like I insist on students, but now you understand the challenge, right? You don't want to, no, students won't want to present in front of everyone else. So how you are going to make them talk? Take turns, not the same person every day, right? So that's also one thing that we all need to learn. Sorry, Dr. Kalindi, please.
Okay, so we can start with the pre-test, the lecture. And after that, our topic is pathophysiology of pain. So we have to give them a lecture, like a didactic lecture about the pathophysiology before proceeding further. And after that, this will be for like we have two sessions. One is pathophysiology and one is for pain assessment. For pathophysiology, we can first have a didactic lecture, and then maybe we can do a post test or we can summarize the lecture. For pain assessment, we can first have a lecture. We can tell them about the various scales that we can use for pain assessment, and that can be followed by a video clip about how to assess the pain. Then we can have a role play from the students. We can divide them into groups, and or we can just have one group who can play the role of patient and doctor and the family member. This can be followed by a case scenario where we can ask them to, we can give them a case and then we can ask them to like separately, one person we can ask what are the components of the pain this patient is experiencing. Other person we can ask them to score the pain, and this can then finally be summarized, followed by a post test just to get a feedback from them.
Thank you, Dr. Kalindi. So just one question to the entire participants. Pathophysiology is something that we never enjoyed learning, I guess, right? It's not something really interesting to. So how can we make it more interesting? How can it be different from? I'm not sure whether there are any physiology teachers in this. So how can we make it a little different? Make it more interesting? What element you want to bring in that? Yes, Dr. Shivan.
There are very nice videos these days which are available online, which teaches the exact pain mechanism. How is it? So we can show them that video.
I think all the students use those apps. When I was interacting with a few students, they learn from those apps where they draw the pictures, all these animations. And I think they come with some, story, right? They usually start with a story. One man got this and then this traveled there. And so I think that's one way of making it more interesting, because this is a very dry subject. So you have to get their interest to listen to the pathophysiology. That's one point. And as trained in this pain management, I guess you will be mentioning about the central sensitization effects, which is not routinely mentioned in any of the pain pathways. So you can start by asking a trigger question. I've heard Dr. Rajagopal uses the trigger question. If the pain stimulus continues, will the experience will decrease, increase, or will be constant? If the stimulus is constant, how is it going to affect? So whether if someone is undergoing constant stimulus of pain, will the experience will be the same, or you will get used to it, or it increases? So these kind of trigger questions can be asked in the beginning, so that they'll start thinking why my answer is wrong, why it is right, and then showing these videos and specifically mentioning about the central sensitization. I think that is the flavor that we all want to bring in, which is something different that we are planning to teach, right? How a patient can come with head to toe pain from a small injury which might have happened a week back, which was untreated, and then he end up having and there what Dr. Sunil mentioned about believing the patient when they say they might be sitting without much of an expression, they may not be crying. So there they learn all this, that patient's untreated pain, what can happen if you don't treat the pain, What if they don't express? How to believe the patient during assessment? So these are the things these are the flavors that we need to add so that they get touch with the reality very early in their learning process. Dr. Sunil?
So one thing which I wanted to tell, you have already told, maybe even giving cases is a way of teaching the pathophysiology. So maybe you can put a case history like this. Mr. So-and-so had a injury or some trauma 6 months back, and he had a pain on a specific area. But there was no proper treatment. And after 6 months, he is coming and complaining of he has pain from head to foot. So is it possible, or is it some psychological or psychiatric problem? So then you ask the students and take the opinion, and maybe after a few responses, you may talk about how this is possible. So there are some mechanisms which then would be very obvious to the students. And um, you can even give some case histories and ask the students what's the type of pain experienced by these patients. A patient with a throbbing pain which is localized to the chest, front of chest, and another patient who is complaining of back pain which is radiating to the leg. And what is there any difference in the type of pain experienced by this patient? And then come and bring the concept of nociceptive and neuropathic pain. And from there, you go to the pain pathway and how nociception happens, dorsal root ganglion and spinal cord, lateral spinal thalamic tract, etc. So I think these aspects can be brought to students like stories, patient stories also.
Thank you, Dr. Sunil. And it's very important, as I said yesterday also, they should feel some interest to learn, apart from writing it for the exams, right? And all these are exam topics. In pharmacology, yes, they have to learn and write about all these medications, and in physiology. So definitely they'll have to learn because it is being asked in the exam. So just to evoke interest, maybe including some scenarios as so they'll start thinking and responding rather than just listening to the pathways. Thank you so much, Dr. Kalindi, for volunteering for presenting for Group 2.
Thank you.
Group 1.
Hello, ma'am.
Yes, Dr. Devashish, please.
I am presenting this test today from my group. Tomorrow, and another member will.
No, it's not. Everyone has been nominated. Because you presented yesterday, everyone might have taken your name. That's yeah. Thank you so much.
Before starting the presentation, this topic we are dealing with the first year students. So total pain is a very new concept to them. So as the structure given to us, it is for 2 hours. So one thing, they are very new, they are very naive to the terminology of total pain, and also they already gone through the basics of the physiology, that is the sensation part and the pain part. Considering all these into account, I prefer the 2-hour session to be divided into 2 days of 1 hour each. And for the first day presentation, it will be the 60 minutes presentation will be started with 10 minutes of MCQ, pre-test evaluation, and 50 minutes lecture in the PPT presentation. Of the 50 minutes PPT presentation, The whole will be given, the whole PPT will be presented in around 30 minutes. Then we will review back to the first slide, and there will be the interactive session for the first slide to the last slide. And after that, these students, they go back to the home. They go through this new concept in different books, and they will again return on the second day. Then they will be given two case scenario, and each of which around 20 minutes duration. That will take about 40 minutes. Then there will be a 10 minutes video presentation, and I will request Kalim India to share us regarding this 3 or 5 minutes clip, and followed by the same evaluation that will be given in the will be put again as a post-test evaluation. This is the for the second day. Now for the first day, the pre-test evaluation, the questions, simple questions, it will be yes or no or multiple choice. That will be based on mainly pain fiber, the types of pain, the pain producing substance, it may be central connection and its manifestations, the nociceptive pain, neuropathic pain. But along with this, some 3 or 4 questions, simple definition will be put forward. That is, what do you mean by social pain? What do you mean by emotional pain? To have the grasp of the knowledge already present in the first year students. Then we will start with the lecture, PPT, and it will be main points will be first the definition, both the ISP definition as well as the layman's definition. That is, what is pain? The patient says that it hurts. That is the pain. And it is easier to describe pain than to define. So as it encompasses the multidimensional aspect of pain. So while describing, there will be the broad classifications of pain, that is acute and chronic, with special reference to the symptomatology and its symptoms. Because the acute pain will be transient and the symptoms are more. That is high BP, high respiratory rate, high pulse rate, there is sweating, there is a dilatation of pupil. Whereas in case of chronic pain, there is mainly different disturbances like sleep disturbances, there is anorexia, there is anhedonia, there is a personality change. And while describing the acute pain, the brief description of pain pathway is inevitable. Though there is a pathophysiology, there is a separate lecture, but some description of the pain pathway will be touched in this portion. And while describing the chronic pain, the different other symptoms come into surface. So some connections in the brain that produces different responses, like if the limbic system is involved, the emotional and autonomic response will be there. If there is temporal lobe involvement, the memory disturbances is there. If there is frontal lobe disturbance, there is pain perception will be different from person to person. If there is sensory area, parietal lobe is disturbed, there is the localization and interpretation of pain. In this way, we are connecting the anatomical and physiological principles of pain. Now, after going through this gross pain part that is already taught go through by the first year students, then we gradually shift our discussion to the total pain. That is a different domains of pain, because the subjective experience of pain is perceived differently by each person. And herein lies the importance of interaction of total pain, with which comprises social, emotional, and spiritual. And here, in this, the last part of the PPT, some descriptions of the physical pain, the social pain, emotional, and spiritual. That the physical pain that negatively impact the physical capability, whereas the social pain, there is the loss of income, the loss of social role, the loss of family, and the damaged relationship. The emotional pain is that it induces depression, it exacerbates anxiety. There is anger in delaying the diagnosis. There is anger to God, anger to himself. If there is disfigurement, which causes emotional pain. And lastly, the spiritual pain, that is why this has happened to me, and if is God is punishing me, there's something like that. And the PPT will end like that. So it can be said that the comprehensive assessment of pain is the basis of the good pain management. And as the assessment can be done on the part of doctor, not only by the clinical expertise, but the active listening and the keen observation and the effective communication skill. That has to be emphasis there. And with this PPT, then we'll rewind back and we'll go through slide by slide if there is any, and there will be done some interactive mode. Now the second that the case scenario will be present, and I always prefer, because these are the first year students, not only the cancer patients, the scenario, because they have the notion that, oh, this is palliative. Palliative care means cancer care. Palliative pain management means cancer pain management. So there will be two case scenario. One is, as has been presented in the module, is a very good case scenario. And another case scenario I have just prepared with that it is a 70-year-old female patient. She is admitted with provisional diagnosis of ischemic stroke presented with right-sided hemiplegia and developed bed sore over the sacral region. And her only son is working elsewhere. And the only person looking after her is her son-in-law. And of late, she developed contracture of the right upper limb and resist any movement of the right arm, and often soils her clothes. And on inquiry to the neighboring patients, they say that the patient is just numb for the last 15 days and she cries at night. With this, the question is the classification of pain of this old lady the patient is suffering, and the contributing factor of pain and the cause of insomnia, and how can you overcome it. So these type of case scenario, two case scenario, 2 minutes, 20 minutes each, followed by the video presentation where different case scenarios that I have described in the good way or bad way. If we show this way, the outcome is this. If we show this way, outcome is that. So this video presentation followed by the same pre-evaluation page that will be given to you to get the final result. And in this way, I think my persistence is of covering the total thing.
Thank you, Dr. Devashish, for summarizing and describing each points, like how will you go ahead with that, and including a non-cancer scenario, maybe the commonest that they might see when they go to the community in their community medicine, family doctor. They might be seeing that more than the other kind of patients. And then, I mean, you have mixed everything. You have shown videos, case scenarios, a PPT, and then interaction. So that might, and divide the session into two, not continuously for 2 hours.
Because ma'am, actually, I actually have diploma in anesthesiology previously. So I have gone through the pain part in that part. Previously, I was in neurology department for 10 years. And now I am a radiation oncologist after passing MD. So the pain part has been, I have seen several patients in several aspects.
Yeah, that's wonderful to know about it. Thank you, Dr. Devashish. Anyone else would like to comment? You can think about it. And Dr. Sunil?
I think what Dr. Devashish's plan is a very good plan. And only suggestion is that maybe it would be helpful if at the start of the session, if we can tell a story of a patient, the story which you have told can be we can tell at the beginning of the class, and maybe ask the students to speak their experience with pain if they have any, and then go detail into the session, and after finishing the session ask the students what are the reasons of pain in this patient. so that we have something which is there, which is stimulating the students from the beginning onwards, and then they will be more attractive or to hear the class. And at last ask them what are the causes of the pain in this patient. So that's only my suggestion. And you have already described what are the changes which can occur in acute pain as well as chronic pain. So those all are good aspects. Yeah, thank you.
Also, ma'am, whether sir also whether some video clips has been shared to us on this platform.
I think we have some videos, Sreedevi.
Yes, yes. Just check. There are links in the trainer's guide. If that is not available, just let me know. We have videos, good video on pain assessment and short videos where Dr. Rajagopal is talking about total pain. So 3-4 minutes video, he's talking physical and social and spiritual, which is meant for undergraduate students. So I thought in the trainer's guide, if you click on the link or copy paste the link in YouTube, you may get. If you have any problem, if you have not received that, just let me know. I'll share the link to the video. We have all the wonderful video on pain assessment where the central sensitization and which is a non-cancer patient and how to believe the patient, even if she looks normal. So everything comes in that pain assessment video.
Sreedevi, I think there is one TEDx talk by Smriti, which is very good.
Yes. So you might have seen during one session on pain, I'm not sure, there is a TED talk video, which is a small 2-3 minutes video where the total pain concept has been said really well by one of our colleague, Dr. Smriti Rana. So I will share that is available. We'll share that link in today's resource material. It's available in YouTube, so we'll share that link. It's a long video, but you need I think the shorter version is enough, that 2-3 minutes. We'll share that shorter version also. So when you are planning to take sessions, if you want some resource material, if you think that if there is a video, it would have been better, or you want to ask us, please let me know. Even after you finish this program and when you go for taking sessions, just let us know. We have enough resource materials. If I overload you with everything, you don't have time to open everything, right? Yesterday, you might have received a lot of resource materials, PowerPoints, this, that, reading reference and everything. So whenever you go for a session, if you want some short video clips or any PPTs, please let me know. Other than what you we have shared, please let us know. We'll be sharing that also. Thank you so much, everyone, for the session. Tomorrow, we will be discussing end-of-life care, which we'll try to incorporate a different model because everyone should participate in all these discussions. We can nominate people to be the presenters for each group. Those who have not spoken will be the presenters maybe for tomorrow. So we can nominate some of your name from the group. Or please discuss in your group that who is going to present. And understand I think it's a learning experience for you also, the challenges when you teach students. So thank you so much for those who have contributed and shared your ideas with us. See you tomorrow with another topic, and tomorrow will be our last session on this faculty development program, and we expect 10 minutes in the end about feedback from your side about this particular 5 days program.
Thank you everyone for joining me. See you tomorrow in the last session. Till then, everyone take care. Bye.